All right, let's dive in. You guys wanted to know more about anaplastic thyroid cancer, and we're here to deliver a clear breakdown.
Absolutely.
So we're going deep into this dense medical journal article, trying to find the need-to-know info without getting
Lost in the jargon, yeah.
exactly lost in all the medical jargon. Got to make it both informative and interesting.
A challenge we're ready to tackle. Anaplastic thyroid cancer is a tough one, but we'll break it down.
Perfect. So first things first, what is anaplastic thyroid cancer?
It's kind of like imagine a cell just forgets what it's supposed to do and goes totally rogue. The cells in anaplastic thyroid cancer lose their normal, structure and function, and doctors call this undifferentiated.
Undifferentiated.
And this is a common thing in a lot of aggressive cancers, which is part of why they're so hard to treat.
So they're like the rebellious teenagers of the cell world, just ignoring all the rules.
Exactly. Multiplying out of control, no regard for the normal checks and balances.
Yikes, that's a little scary. So how common is this type of cancer? The article mentioned it's pretty rare, right?
Extremely rare. We're talking about 1 to 2 cases per million people every year.
Mm.
And it's mainly seen in women, usually over 65.
Wow, those are really small numbers. Does this rarity impact research or awareness of the disease at all?
Unfortunately, yes. Rare cancers often receive less funding and attention compared to more common ones.
That makes sense, but it's still a shame. The article also mentioned something about a connection to other slower-growing types of thyroid cancer.
Right, about 20% of patients with anaplastic thyroid cancer have a history of what's called differentiated thyroid cancer. So it's possible the anaplastic type could develop from these less aggressive forms.
Hold on, back up a sec. Can you quickly explain the different types of thyroid cancer? I think our listeners would appreciate a little thyroid cancer 101.
Sure. The most common types are papillary and follicular thyroid cancers. They're differentiated because their cells still kind of resemble normal thyroid cells. They grow slowly and have a better outlook. Anaplastic is the outlier. It's the aggressive one.
So if someone's had one of those slower growing types, they could be at higher risk for developing anaplastic later on.
That's the current thinking, and it's really important for figuring out the best way to treat and monitor patients.
Got it. So we've got this rare aggressive cancer that might develop from existing thyroid cancer. What about symptoms? How does it show up?
Well, early on, anaplastic thyroid cancer can be sneaky. The most common symptom is a rapidly growing mass in the neck.
How rapid are we talking here?
Like doubling in size within a week or two, that's a big red flag.
Wow, okay.
Early detection is essential with this one.
That's definitely alarming. Are there any other symptoms besides the lump to watch out for?
Yeah, because of where the tumor is, it can start pressing on or even invading stuff in the neck. This can cause neck pain, trouble swallowing or breathing, hoarseness, and even a cough that just won't quit.
So it's not just the tumor itself, but the impact it has on everything around it.
Exactly. And then there are the general symptoms, weight loss, feeling tired all the time, maybe even a fever. It's not always easy to connect those back to the thyroid, but they're important to pay attention to.
So, okay, you have this rapidly growing lump, maybe some breathing issues, maybe some fatigue. How do they diagnose it?
Usually the first step is a fine needle aspiration biopsy. They use ultrasound to guide a very thin needle and extract some cells from the suspicious area.
And that tells them for sure if it's cancer.
Most of the time, yes. But sometimes the results aren't clear-cut. If there's too much inflammation or dead tissue, they might need to do a bigger biopsy.
I see.
Yeah.
The article mentioned immunohistochemistry. What is that?
Think of it like using antibodies to give each cell a unique fingerprint. It helps identify specific proteins on the surface of the cells, so pathologists can tell the difference between anaplastic thyroid cancer and other cancers that might look similar under the microscope.
Oh, so it's not just about how the cells look, but what their ID card says. Makes sense.
Exactly. Adds another level of certainty to the diagnosis. And with a cancer this aggressive, getting the diagnosis right is absolutely crucial for making the right treatment decisions.
That makes sense. Speaking of treatment, the article said that staging for anaplastic thyroid cancer is always advanced. Is that true?
Unfortunately, it is. By the time it's diagnosed, it's almost always spread beyond the thyroid, which puts it automatically in stage 4.
Wow, stage 4 right away. That's a bit daunting.
It is. But even within stage 4, there are substages, IVA, IVB, and IVC, that show how far it's spread. This helps doctors figure out the best treatment and get a better idea of the prognosis.
Okay, so even within stage 4, there's a range of severity. So let's talk about treatment. The article discussed surgery, radiation, and chemotherapy. What's the overall picture? How effective are these treatments for anaplastic thyroid cancer?
Well, that's where things get really tricky. Anaplastic thyroid cancer's aggressive nature and the fact that it's often diagnosed late make it extremely hard to treat. Surgery, for instance, is often not an option because the cancer has already spread too far.
But the article did mention that surgery is sometimes possible.
Yes, but only in rare situations where the tumor is caught super early and seems to be contained within the thyroid. And even then, it's a very aggressive surgery, often involving removing the thyroid, nearby lymph nodes, and sometimes even parts of nearby muscles or organs.
So surgery's a long shot at best. What about radiation? Isn't that pretty standard for cancer treatment?
It is, but traditional radiation therapy hasn't really been effective against anaplastic thyroid cancer. The cells seem to be resistant to the usual doses.
So is radiation completely off the table?
Not necessarily. There's this newer approach called hyperfractionated radiotherapy where they give smaller doses of radiation more often. When it's combined with chemotherapy, it's shown some promise.
Interesting. What makes this newer approach more effective?
The idea is to hit those rapidly dividing cancer cells more effectively while minimizing damage to healthy tissue by using smaller, more frequent doses. And combining it with chemotherapy kind of creates this two-pronged attack.
Ah, I see. That makes sense. What about chemotherapy? What are the main drugs they use for anaplastic thyroid cancer?
The most common treatments are based on a drug called doxorubicin. There's also some evidence that combining it with other chemo drugs like cisplatin or docetaxel might lead to better outcomes.
But it sounds like even with these combinations, the prognosis isn't great.
Unfortunately, that's true. The reality is anaplastic thyroid cancer has a very poor prognosis. The average survival time is only about 3 to 7 months.
That's incredibly difficult to hear.
It is. But it's important to remember that these are just statistics. Everyone is different, and there are always exceptions.
Of course. What about cases where the cancer has spread to other parts of the body? The article called this metastatic disease, right?
Yes. And sadly, once anaplastic thyroid cancer has metastasized, there isn't a truly effective therapy. At that point, the focus shifts to palliative care managing symptoms, improving quality of life, and providing support for both the patient and their family.
That must be such a challenging situation for everyone involved.
It is. But palliative care makes sure patients can live the time they have left with as much comfort and dignity as possible. It's about compassionate, holistic care that addresses not just physical symptoms, but also the emotional, social, and spiritual needs.
It's important to remember. So we've covered a lot. It's rare, it's aggressive, it's hard to treat. What are the key takeaways for our listeners so far?
The most important thing is that time is of the essence with anaplastic thyroid cancer. Early detection is crucial, so if you notice any unusual lump or swelling in your neck, don't wait. See a doctor right away.
Yeah, knowing the signs and symptoms could really make a difference. We've talked about what anaplastic thyroid cancer is, how it presents, and the challenges of treatment. But before we move on to the next part of our deep dive, let's give our listeners something to think about. Given the limitations of treatment right now, what areas of research hold the most promise for improving outcomes in the future?
That's a great question to ponder. We'll explore some potential answers in the next part of our deep dive.
Awesome. Looking forward to it. So we've just discussed the harsh realities of treating anaplastic thyroid cancer.
Yeah.
But you did mention some promising research, some glimmers of hope on the horizon.
Absolutely. There are some exciting possibilities emerging from ongoing research.
Good, because it was getting a bit heavy there.
Yeah, I know.
One thing you mentioned was targeted therapy.
Right.
That sounds like a game changer. Can you explain what it is exactly?
Basically, instead of attacking all rapidly dividing cells like with traditional chemo, targeted therapy zeroes in on very specific molecules or pathways that those cancer cells need to grow and survive.
Ah, okay. So it's more like a sniper taking out the enemy's command center rather than just carpet bombing everything.
Exactly. It's about precision. And that precision means less damage to healthy cells, which could mean fewer side effects.
I see. That's awesome. So how do researchers even find these weak spots in anaplastic thyroid cancer cells?
It all comes down to understanding the cancer's molecular blueprint. Scientists are working really hard to identify the unique mutations and pathways that are driving this uncontrolled growth in these cancer cells.
So they're like creating a detailed map of the cancer's inner workings, and then they're looking for the best spots to disrupt it.
That's a great way to put it. And once they find those key targets, they can develop drugs that specifically block them.
That's pretty cool. So are there any targeted therapies being investigated specifically for anaplastic thyroid cancer?
Yes, several. One promising area is targeting a mutation in the BRAF gene, which they've found in a good number of anaplastic thyroid cancers.
URIFAF.
And luckily, there are already FDA-approved BRAF inhibitors used for other cancers. Early studies are suggesting they might also be effective against anaplastic.
So they're like repurposing drugs, finding new uses for them.
Exactly. And that can be a faster way to get treatments to patients, which is a huge advantage for rare cancers, where developing new drugs can take a really long time and a lot of money.
Yeah, definitely. Any other targets on the radar?
Well, another one is the PI3-KAKT-mTOR pathway.
Well, say that again.
PI3-K8-KT-mTOR pathway. It's a mouthful, but basically it plays a crucial role in how cells grow and multiply, and drugs that inhibit this pathway have shown good results in early studies.
Okay.
So clinical trials are underway to see how safe and effective they are in people.
So we've got BRAF inhibitors, PI3K pathway inhibitors. What else? Any other approaches being explored?
Definitely. There's a lot of excitement around a class of drugs called tyrosine kinase inhibitors, or TKIs.
Okay.
These TKIs block the action of enzymes called tyrosine kinases, which are involved in all sorts of cell processes, including growth.
I see.
And many anaplastic thyroid cancers have overactive tyrosine kinases, making them prime targets for these drugs.
Got it.
There's also immunotherapy.
Right. Immunotherapy, that's a hot topic. How does that work?
Immunotherapy harnesses the power of the patient's own immune system to attack the cancer cells.
Could it be effective for anaplastic thyroid cancer?
It could be. Different types of immunotherapy are being tested in clinical trials right now.
So we've got BRAF inhibitors, PI3K pathway inhibitors, TKIs, immunotherapy. That's a lot of research going on.
It is. It's great to see so much attention on anaplastic thyroid cancer, right?
Yeah, that IS encouraging. What does all this research mean for patients who are facing this diagnosis right now?
The most important thing is don't lose hope. Even though there's no cure yet, there are reasons to be optimistic.
Oh.
The research is moving quickly, and new treatment options are popping up all the time. And of course, palliative care can always help manage symptoms and improve quality of life.
That's good to hear. So you mentioned clinical trials. They're sort of the bridge between research and real-world treatment, right? Why are they so important, especially for these rarer cancers?
Clinical trials are absolutely crucial.
Yeah.
They're how we make sure new treatments are safe and effective. All those drugs and therapies we just talked about wouldn't be available without them.
So clinical trials are like the testing grounds, where they figure out if these treatments really work.
Exactly. They figure out if a drug is effective, what the right dose is, and what the side effects might be. And they also generate valuable data that can guide future research.
I imagine it can be pretty intimidating for someone facing a serious illness to consider participating in a clinical trial.
Oh, absolutely. It's understandable to feel hesitant,
For sure.
but participating in a clinical trial can have some real benefits.
Like what?
Well, first of all, it gives you access to cutting-edge treatments that you might not be able to get otherwise. It's kind of like a sneak peek into the future of medicine.
I like that.
There are no guarantees, but these new treatments sometimes offer better outcomes compared to the standard options.
Right. What else? Are there any other benefits?
Well, you're not just potentially helping yourself.
Right.
You're also contributing to medical knowledge and helping future patients.
Okay.
Your data will help researchers develop better treatments down the line. It's like being part of something bigger than yourself.
I like that.
And you also get really close monitoring and expert care throughout the trial. So it's not just about the experimental treatment itself, but also the overall care that comes with it.
I get it. So it's important to have a conversation with your doctor to see if a trial might be a good fit.
Definitely.
Okay, so we've talked about targeted therapy, immunotherapy, and clinical trials. What's the main takeaway for someone trying to make sense of all this anaplastic thyroid cancer research?
The key is to stay informed. Talk to your healthcare team about your options, and don't be afraid to ask questions.
Right. Knowledge is power, as they say.
Exactly.
So now let's talk about something that often gets overlooked, and that's the importance of a multidisciplinary approach to care.
Yes, that's very important.
What does that even mean in the context of anaplastic thyroid cancer?
So instead of just having one doctor managing everything, a multidisciplinary approach means that you have a team of specialists working together to come up with the best possible treatment plan.
Oh, okay.
It's kind of like assembling a dream team of medical experts to tackle the cancer head-on.
Love that analogy. So who's on this dream team, typically?
Usually you'll have a surgeon, a medical oncologist, a radiation oncologist, an endocrinologist, a pathologist, and possibly a palliative care specialist.
Whoa, that's a lot of specialists.
Yeah, but that's what makes a multidisciplinary approach so powerful. Each expert brings their unique perspective to the table, which leads to a more well-rounded and personalized treatment plan.
Okay, so let's break it down. What are the specific roles of all these different specialists?
Okay, so the surgeon obviously handles any surgical procedures. As we discussed, surgery isn't always an option for anaplastic thyroid cancer.
Right, right.
Then you've got the medical oncologist who's in charge of the chemotherapy.
Okay,
They'll figure out the best regimen based on the stage of the cancer, the characteristics of the cancer, and your overall health.
got it. What about the radiation oncologist?
The radiation oncologist will be in charge of any radiation therapy, whether it's the traditional type or that newer hyperfractionated approach we talked about.
Okay, so that covers surgery, chemo, radiation.
Mhm.
Where does the endocrinologist fit in?
The endocrinologist is a hormone specialist, and they play a super important role in managing thyroid cancer, especially if the patients had their thyroid gland removed.
Why is that?
Well, the thyroid gland produces hormones that are essential for, regulating metabolism and a lot of other bodily functions. So if they remove the thyroid, you'll need to take hormone replacement therapy for the rest of your life.
Oh, okay.
The endocrinologist helps manage that, monitoring your hormone levels and adjusting the dosage as needed.
That makes sense. We talked about a pathologist earlier. What's their role on this team?
The pathologist is a critical member of the team. They're the ones who analyze those biopsy samples under a microscope.
Right.
They confirm the diagnosis, determine the cancer's type and stage, and identify any specific markers that might be relevant to treatment.
So they're like the detectives, gathering all the clues from the cancer cells.
Exactly. Their input is crucial for crafting that personalized treatment plan.
And finally, we have the palliative care specialist. What do they do?
Their focus is on improving the patient's quality of life. They work closely with the patient and their family to manage pain and symptoms, provide emotional and spiritual support, and just help them navigate the whole medical process, which can be really overwhelming.
So they're like the patient advocates, making sure the patient's needs come first.
Exactly. They play a vital role in providing compassionate and holistic care.
That's great. So it really is a team effort.
It is.
And that's why it's so important to find a cancer center that really embraces this multidisciplinary approach.
Absolutely.
It's not just about finding one doctor. It's about finding a whole team of experts dedicated to working together for you.
Exactly.
So we've been exploring this really complex disease, anaplastic thyroid cancer,
Yeah.
and we've talked about the tough stuff, treatment challenges, the impact on patients and families. But there's one more thing we need to discuss: prevention.
Right. Prevention. It's a crucial part of the conversation.
Exactly. So are there things people can do to actually prevent this type of cancer, or at least lower their risk?
Well, there's no guaranteed way to prevent it completely,
Okay.
but there are things that might reduce your risk.
That's good to know. So what are some of the risk factors? What increases someone's chances of developing anaplastic thyroid cancer?
One of the biggest ones is age. Remember we talked about how this cancer is most common in folks over 65?
Yeah, that's right. So getting older is a risk factor, and that's not something we can really change. Anything else?
Another big one is radiation exposure, particularly to the head and neck area. This is a known risk factor for thyroid cancer in general.
Okay, so that makes sense. Is this something people should be worried about in their everyday lives? Or are we talking about major radiation events?
No, not everyday exposure. Thankfully, that's generally pretty low.
Right.
We're talking more about higher doses, like what you might get with certain medical treatments or in some occupations.
Okay, so someone who's had radiation therapy to the head or neck in the past might be at higher risk.
Exactly. It's important to know about that risk and talk to your doctor about monitoring.
What about family history? Does that play a role in anaplastic thyroid cancer?
Having a family history of ANU type of thyroid cancer can increase your risk a little bit, but for anaplastic specifically, not really.
So it's not like those other cancers that have known gene mutations passed down through families.
Right. Anaplastic seems to be different in that way. However, there are some rare genetic syndromes like Cowden syndrome and Werner syndrome that might increase the risk.
Okay, so those are pretty rare.
Yeah, pretty rare. But if you have a family history of those or really any unusual patterns of cancer in your family, it's worth talking to your doctor.
Got it. So age, radiation exposure, some rare genetic syndromes. What about lifestyle factors? Do things like diet or exercise have any impact on the risk of developing anaplastic thyroid cancer?
Honestly, there isn't enough solid evidence to say for sure. But as always, a healthy lifestyle is good for everyone. A balanced diet, regular exercise, maintaining a healthy weight, those are always good things.
Yeah, the classic advice: can't hurt, Might help. So, for anaplastic thyroid cancer specifically, it sounds like early detection is really the key message.
It really is. Knowing the warning signs is so important.
Right. We talked about those before: rapid lump growth in the neck, trouble swallowing or breathing, hoarseness, persistent cough. Yeah. If someone notices these, what should they do?
Don't wait. See your doctor immediately. It's always better to be safe than sorry.
Absolutely agree. Well, we've covered so much in this deep dive into anaplastic thyroid cancer.
We have.
The challenges, the research, the importance of awareness, and all those resources that are available. Before we wrap up, is there a final message you want to leave our listeners with?
I'd say this. Anaplastic thyroid cancer, IS, a serious and challenging disease.
Oh.
But it's not hopeless. Research is making progress, new treatments are being developed, and there's support out there for patients and their families.
I like that it's not hopeless.
Exactly. Never give up hope. And keep learning, keep connecting with others. That's what helps us through tough times.
Beautifully said.
Yeah.
Thank you so much for sharing your expertise with us today. This has been a truly eye-opening look at anaplastic thyroid cancer.
My pleasure.
And to all of our listeners, thank you for joining us for another deep dive here on the show. Until next time, stay curious.